Hello, we are going to go over how to chart. It's just a little refresher on how to do the chartings. So we're going to review it and make it a lot simpler. So this is the SOAP note template, which the SOAP note is just a subjective objective. So subjective objective, the assessment, and then the plan. So every day you'll fill this out on a client. You put their name, the date of the service, what time you started it, which is generally about 8 o'clock in the morning, to what time you finish it, which is usually about 2 o'clock in the afternoon. And then you can multiply out those minutes. And then you report anything the client told you or that you heard them talking about that is applicable here. And so this can be kind of different than how we're accustomed to doing things, because this is where you're looking for the negative, not the positive. You're trying to show the different entities why the person should be in treatment, not the reasons they shouldn't be in treatment. So it's a different approach, a different perspective than what you might typically look at. But it's, have you seen the person be in a bad mood or getting into arguments with other people? Have you heard the person talking about things that stress them out or that are frustrating to them? Do they have poor insight? Are they saying that it's dreary outside when you're seeing nothing but rainbows and butterflies? This helps to articulate things that they are seeing that may not be the norm, quote unquote. You can also talk about spiritual conditions. So are they saying that they believe in God or they don't believe in God? They're having a crisis of faith, or they have recently come to faith. That can be very important in this client report, as well as cravings. So a lot of people feel shame, and when we talk about cravings, like they feel shamed that they're craving a drug or something like that. And that's not something that we need to shame them for. It's that we need to acknowledge it. The Bible actually says that we are to confess our sins one to another. And so if they are having cravings, if they're reporting nicotine cravings, drug cravings, it can even be cravings of another gender or same gender. Report those things here. And then any challenges they're facing. Hey, I'm having trouble sleeping. I'm having trouble getting my homework done. I'm having trouble getting along with someone. Any challenges that they're talking about. I'm having trouble staying in the program. I want to leave. You would mark that here. And then client statements in their own words. This is a great place where you can further articulate the things that you saw up here or heard up here. Again, this needs to be more focused on the negative than on the positive, because you're trying to prove why they need treatment, not why they don't need treatment. And then risk-related self-reporting. So did they talk about wanting to hurt themselves or wanting to hurt somebody else? Did they talk about past self-harm opportunities, or that, that could be a craving just the same, like that's something that they're wanting to do. So you would articulate it here. And then substance use urges or cravings. So you will notice that it is articulated here. It can be articulated here, and then it's also articulated here. This is extremely important. If they are talking about it, if you've heard it, if you know it, you need to make sure and state it, because we want to make sure that we are addressing it with all four quadrants.